Hi guys, hope you're doing well. The topic of discussion is paracetamol. So we will discuss different aspects of paracetamol. We will start with the overview, then mechanism of action, indications, dosage, side effects, contraindications, interactions, and overdose or toxicity. Paracetamol is a non-opioid analgesic. Analgesics are mainly divided into two types, the opioids and the non-opioids. In the non-opioids, we have NSAIDs and paracetamol. The chemical name for the paracetamol is para-acetylaminophenol, and the pharmacological or the generic name is acetaminophen. It has analgesic, antipyretic, but no anti-inflammatory effect. We will discuss in the mechanism of action that why it does not have anti-inflammatory effect. It is used in mild to moderate pain where anti-inflammatory effect is not necessary, and it is preferred over NSAIDs for patients with the history of gastric ulcers. And the mechanism of action or mode of action. The exact mode of action is still a mystery because there are several hypotheses regarding the mechanism of action of the paracetamol. But the recent studies are showing that it selectively inhibits the unknown cyclooxygenase enzyme COX-3 centrally in brain and spinal cord, and it has no pronounced action on COX-1 and COX-2. Normally, arachidonic acid is converted to prostaglandins through the enzyme cyclooxygenase 1 and 2, and these prostaglandins are responsible for the inflammation, pain, and fever, which are inhibited by the NSAIDs. And those prostaglandins from COX-1 are responsible for the activation of platelets and the production of mucous membrane in the GIT. As paracetamol has no much effect on COX-1 and COX-2 in the peripheral, so it is free from the side effects of COX-1 and COX-2 when inhibited. In the indications, as we discussed previously, it is used in mild to moderate pain like headache, toothache, migraine, and also in fever. Generally, paracetamol is used in all body pains when there is no inflammation. Dosage is the dose administered in a specific frequency with a specific time interval. For adults, it is 500 to 1000 mg single dose every 6 hours per oral, and the amount of single dose depends on the severity of the pain, and the maximum dosage is 4 grams per day in divided doses. And for pediatrics, who are less than 50 kg in body weight or younger than 12 years old, it is 10 to 15 mg per kg per dose every 6 hours per oral, and the maximum dosage is 75 mg per kg per day. The side effects. The most common side effect of the paracetamol is the liver damage, although there is no serious liver damage in between the normal doses. Furthermore, we will discuss the liver damage and the toxicity of the paracetamol. It may also cause some allergic-like symptoms, which includes red and itchy skin and shortness of breath. And the rare side effect is the blood dyschiriasis, in which the blood cells get decreased. The only condition in which paracetamol is contraindicated is the hypersensitivity of the individuals for it. The hypersensitivity reactions may be IgE mediated or due to the increased production of the leukotrienes. Although the IgE mediated reactions are very rare, but the hypersensitivity due to the increased production of leukotrienes is about 1.6%. And interactions. It may be drug-drug or drug-disease interactions. Although there is no serious drug interaction of the paracetamol with the other medications, but it may interact with the warfarin to increase the prothrombin time, and the etoprides increase the gastric emptying time, which alters the absorption of the paracetamol. In drug and disease interaction, there is liver damage and alcoholism. It is because of the low level of glutathione in both conditions. Overdose or toxicity. The toxic dose is 7.5 to 10 grams, which is far away from the maximum normal dose, and the lethal dose is 10 to 15 grams, in which death occurs due to multi-organ failure. NAPKI is a toxic byproduct of paracetamol metabolism, which causes depletion of glutathione that leads to liver damage. Actually, glutathione acts as a protective mechanism for the hepatocytes. And alcohol also reduces glutathione level. In case of overdose or toxicity, the antidote known as N-acetylcysteine is administered to increase the glutathione level. Thanks for watching, and comment below for any improvement in the coming videos. Like and subscribe. Thank you.